breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison.
Hey.
Looking dapper and handsome as ever, my man.
Oh, look at that. Look at that. That's nice. That's
flattery
nice.
will only get you.
Flattery. Get the job done, right? How is the evening going for you?
Good, man. Had a good meal with the kids and the wife, and gonna carry that momentum right on into this podcast.
Nice. Yeah. So this podcast is kind of interesting. We've done something a little bit similar to it, but we see some challenges of calls that we get. And I think, so from a doctor standpoint, but I think also from a patient standpoint on what the obstacles that they have when they start making changes in their life with their loved ones.
Yeah. I think that this really rang home for me yesterday, truly, because I had a patient, I was supposed to have a new patient yesterday. And I asked our office manager, I was like, what happened to that new patient that was supposed to be here at like 11? She's like, oh, I called her and she said her husband was unable to make it because she had made the appointment and he did not want to come. I was like, okay, like that just reaffirmed why we need to do a podcast like this.
So she wanted him to come in to get help.
And he did not want to come. So he did not come, obviously.
So she wanted him to get healthy, but maybe he didn't see the importance in it.
Well, maybe not yet. Yeah.
Not yet. One time, maybe.
So we're talking again about, say you're making changes or you'd like to encourage your spouse to make health changes. How do we lead and how do we basically help them achieve what they want to achieve or support them? And yeah, it's going to be an interesting one. We've done one similar to this in the past, but this is kind of unique by itself. So stay tuned, hit like and subscribe. Turn on notifications because we're going to continue to roll out topics, similar, different, in some facet related to health each and every week.
Yeah. And health is a lot more than just blood chemistry. If anybody's following this podcast, health is every aspect of life.
Yes.
So ultimately the goal of health the purpose of health is to enjoy life to the fullest.
That's right. Live a long, meaningful and unrestricted life.
So this is important because it's a problem for many, and having the desire to help one, like the case that you said, someone, and everybody listening to this, we always want the best for their family and their loved ones. They always want them to be the healthiest. And sometimes we want it more for them than they want it for themselves. In fact, this happens all too often, I think. And
very often.
And what can we do in the situation? What can people do if, I want my mom to improve whatever aspect of her health, and I'm trying to get her to do it. And I'm calling doctors. I'm calling doctors to make appointments for her. And these natural doctors, they're not just going to necessarily give her a pill. She's going to have to participate in her health. So what could these people do?
Well, first, I think that you have to kind of determine what the goals are for the patient, like the person that you're trying, say it's your mother. You have to have a really real and honest conversation with them, and you don't want to be judgy or pushy, but I think that the biggest thing that I've seen that has been successful in helping people achieve the changes they want is that they've had a real conversation, like, I really want you to be around for X, Y, and Z. I want you to be able to participate, as in X, Y, and Z as we get older, or even if it's a physical thing, I want you to age healthy. I want you to be around because you're a little bit overweight. I want you to be able to participate because I think that that's a big thing that's a big reason a lot of people want their friends, family, and loved ones to get healthy so they can participate, they can be a part of it. But I think there's a fine line. I don't think that you want to be judgmental because you can't be judgmental. You can't be overly pushy because that's just going to really turn them off to it. And I've seen a lot, I'm sure you have.
Yeah. And you can't push advice down their throat.
No, especially if they're not asking for it. Right.
Yeah. So we got to remember, what is our goals for this individual and what are their goals for themselves?
Right.
They might be doing it for noble intentions, but that doesn't necessarily mean that they see it in the same
Or that
way.
it's their desire. They might be,
That's right.
And that's ultimately what it's got to be.
And
I
it's
think
hard.
one thing that,
It's hard to watch these people that we love, watch their health fail if we are very confident there's something that they can do. It's horrible to have to watch it, but we have the choice to either support and motivate in a gentle fashion, or push them away from us and make it even worse.
I think that one thing that happens all too commonly, in fact, we just talked about it with me, is don't call and ask for advice from a doctor about, so-and-so when the doctor hasn't met them.
Their family or their significant other.
So because it's going to be it's going to be terrible advice if they give you advice, and that patient's got to be motivated to show up, because they're not just going to be able to treat them over the phone. So if they're willing to go in person, and don't schedule the appointment for them. Yeah. Allow them to schedule the appointment. You can do everything in your power. Hey, found this great provider. I found this great provider. Here's their contact information. Why don't you call and schedule an appointment? They have some I even called and asked if they're taking new patients and have any availabilities this month. Here you go.
That's right.
That's all you can do. You can't schedule anything else for them.
That's right. I get a call, at least one call a week. My cousin, my aunt, and sometimes, it could be they're just helping find that contact, like you're suggesting. But the vast majority of them, I really need, my aunt has XYZ problems. They need your help. What can I do? What can she do? Well, she's an adult. She'd have to give us a call to schedule. But it isn't that these individuals are, trying to be pushy on the doctor. No, they just want to do everything they can for their loved one. And it hurts. It absolutely hurts to watch that.
Yep.
So, so get them to be involved in it, open the doors for them, support them, be the role model. Don't be the pushy, don't be the drill sergeant, don't be any of that. And if you've made a lot of changes and you're trying to take care of your loved ones, lead by example. There's nothing more powerful than that, especially with couples. I just talked to this couple today, and actually the wife of a husband that I worked with, and I was talking today. I ran into her today, and she was talking about her husband, because we worked with him in the past, and he's doing really good, and he's working out every morning. And I said, "Oh, that's great." She said, "Yeah, at 4 a.m, and then he gets up to go, and I know I have to go too." So his motivation, leading by example. I talked to him about this. I said, you do not push your wife to do this, because he's worried about her now. Now his health is better. He's worried about her. Do not push her, because then you're going to need, couples counseling. Just do what you need to do. She will follow. And that's exactly what's happening. And there will be times where maybe he's feeling a little bit lazier in the morning and she's up and ready to go, and that'll motivate him to go. Couples can be very powerful as long as they realize their roles. Yeah.
So some other things that you can do to support them, positive, or give them the support they need, reinforce, don't, I guess it's a fine line, because you're not there to parent them, right? You're just there to support them, but you don't have to necessarily condone or encourage or react to things that, if they decide that they're going to implement changes that maybe are counterproductive for it. So, hey, you want to go to Pizza Hut? No, I don't.
That's right.
You don't have to support it. And
yeah,
I think the biggest part. Oh, sorry. Go ahead.
I never thought of that Pizza Hut analogy, or whatever, fast food, or a poor decision.
Yeah.
All you have to do is, yeah, honey, I'll go. And you automatically create a positive reinforcement, reinforcing to continue that behavior, versus saying, actually, no, I'm watching whatever it is that I'm eating. And that'll not be an insult to them, but it'll be like, wow, okay. And that, yeah.
So, yeah, I mean, and then aid them any way they can, right? If they're eating healthy, obviously be supportive of that. Lead by example, eat healthy. They want to exercise and you're already doing it, invite them. You know, there's a lot of stuff you can do. I think the biggest thing for this podcast for us today was, what are some things that maybe you are doing that are sabotaging that individual before you're even starting? And I think the biggest thing is you have to meet that person where they are to start. Like, you can't take the initiative for them. They have got to be willing and wanting to get started. And then you just have to basically facilitate that in a way that's conducive for their improvement. That's
right. This is very hard to do, especially, again, loved ones or significant others or families, when we're watching their health decline. We're seeing all the red flags. We're seeing them over time get worse and worse and more, medical doctor appointments, more and more pharmaceuticals. We worry. And if we're not dealing with that trouble, those health issues, but we see our significant other, what do we want to do? We want to shake them and tell them what they've got to do. And that is the worst thing to do. It's hard to watch, but the most powerful thing, as you said, Dr. Kolby, is lead by example. Just keep doing what you need to do, and don't give positive reinforcement to, again, the Pizza Hut analogy. I really like that, because I think we do it. I think it's subtle. I want to spend time with my loved one, my significant other, but I don't like going to, doing X, Y, and Z.
I mean, I had this happen with patients where the wife was committed to eating healthy. She was feeling really terrible. She had a bunch of adverse food reactions. She was eating a certain way. Husband followed for a while to try to be supportive, and he's not exactly the picture of health either. And, towards the end, she goes, well, my husband's, he's just withering away. And I was like, what do you mean? And she goes, well, he is unwilling to eat the way that I am. And she was the primary cooker in the house. And she goes, I just don't have the energy to prepare 2 meals. And I was like, well, I can understand that. And so he had gone back to eating really terrible. Mm-hmm. So she was worried about that. So I guess on the other side too, if it's someone that's really trying to improve themselves, just be as supportive as you can, because that sabotaged her as well.
Oh, she slipped.
Yep.
She fell out of it.
Yeah, it's been an interesting dynamic, to say the least. But it can go either way.
So. Yeah, it can go either way. And the I don't know, the individual with the weaker will be the one that'll bend to the other party. Mm-hmm. Always. And yeah, it's hard to watch. That's one thing. Lead by example. Usually those people come around. This is such an important thing, and I talked about it on another podcast. When I'm working with somebody that needs help that needs to improve their health, and then the other person not so much, or maybe they're just not concerned about their health. When the one sick person starts to improve their health and get better and better and better, they start worrying about their significant other. And then I have to have a conversation with them immediately. Say, this is your role in your health. This is your role in your relationship. It is not being that drill sergeant, because you will create a divide. You'll put a wedge between the two. It's hard for them to watch, but the ones that I work with that stick to it, and you have that iron will, the husband or the other partner ends up starting to come online and following it. Maybe not all the way in, but at least somewhat. So we can't push our health on our loved ones.
That's right.
Because we'll destroy our relationships with them.
Yep.
Mm-hmm. So
if you got value out of this, was kind of interesting one. I think it was valid though. I think
it was. We see it every day, and we know people see it every day. So if people are listening to this, their podcast, they're looking for health information. They're working on improving their health, and sometimes they might be pursuing our podcast for their significant others.
There you go. Mm-hmm. So this one's valid, right? So again, hit like and subscribe, turn on notifications. If you'd like to contact us, we have an email associated with the podcast. It is info@brainstormingwiththedocs.com. You can get on our websites to find more information as well. Mine is northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. You can look at the description, and we put the links in there to those as well. And stay tuned, because we're going to continue to roll out different topics each and every week.
That's right. Well, that looks good.
Next time, buddy.
We'll talk soon.
All right. Bye-bye.